Imagine waking up tomorrow and antibiotics don't work. Not less effective, not some bacteria. All antibiotics fail. Penicillin, amoxicillin, ciprofloxacin, the entire class useless. Here's the twist. Modern medicine doesn't collapse because we lose a pill. It collapses because antibiotics are the safety net under everything. Surgery, childbirth, cancer treatment, organ transplants, even a simple cut. All of it assumes we can control infection. Before we start, if you like expert breakdowns of extreme what-if scenarios, hit like and subscribe, because this is a series. Now let's do this logically. Not fear, not headlines, a timeline. What breaks in the first 24 hours, the first week, the first month, and what modern medicine becomes without antibiotics. Quick clarity. Antibiotics treat bacterial infections. They don't treat viruses, so this is not all medicine fails, but it still hits like a planet-wide earthquake, because bacteria are everywhere. Your skin has bacteria, your gut has bacteria, air, water, surfaces, bacteria, and normally that's fine. The reason it becomes deadly is simple. In modern medicine, we create situations where bacteria can invade. Cuts, surgical incisions, catheters, ventilators, IV lines. Antibiotics are the backup plan when barriers fail. Now remove the backup plan. The system changes overnight from treat and prevent complications to avoid risk at all costs. And that flips medicine from proactive to defensive. So for this scenario, assume no effective antibiotics exist. No new miracle drug arrives in time. We still have antiseptics, sterile technique, and supportive care, but once a serious bacterial infection starts, we're mostly managing damage. Now the timeline begins. Day 1. Hospitals don't collapse instantly. They freeze. Elective surgeries, canceled. Because elective surgery without antibiotic protection becomes a gamble. Joint replacements, hernia repairs, dental implants, all delayed. Next, high-risk wards go into emergency protocol. ICUs become more conservative with invasive lines. Ventilator use becomes riskier. Because ventilators increase infection risk, and bacterial pneumonia becomes far harder to control, doctors stop doing procedures that create infection pathways. And the weird part? You won't see the full effect immediately. You'll see it in the cases they refuse to do, because when a system loses a safety net, its first response is fear-based shutdown. And that shutdown saves some patients short-term, but it also creates a backlog, and backlogs are what kill later. By day 2 and 3, the psychology shifts. A cut is no longer annoying. It's a decision point. Do we admit? Do we isolate? Do we risk an invasive drain? Because now every infection can escalate into sepsis with fewer options. And this is where the public starts noticing. ER visits spike. People panic over symptoms that used to be routine. UTIs, skin infections, dental abscesses. Doctors respond with old-school medicine, drainage, cleaning, debridement, isolation, aggressive supportive care, basically physical control of infection, not chemical control. But here's the brutal truth. Supportive care can buy time. It can't replace a working antibiotic in many cases. So by day 3, the system begins triage. Not officially at first, but quietly. Who gets a bed? Who gets a procedure? Who gets sent home? Week 1 is the real gut punch. Because the big impact is not infections from daily life. It's infections from medical care itself. Surgeries become ultra-restricted. Only life-saving operations continue. Trauma, appendicitis with rupture risk, internal bleeding, emergency C-sections, but even those become riskier. Now childbirth. Childbirth already carries infection risk. Postpartum infections, C-section infections, normally manageable. Without antibiotics, maternity wards shift into near-quarantine behavior, stricter sterile protocols, fewer interventions, more home births attempted, which can backfire. And that creates a paradox. Trying to avoid hospital infection risk can increase overall maternal and newborn risk if complications occur. So within a week, medicine becomes a new world. Less intervention, more prevention, more fear of breaking the skin. Month 1 is where modern medicine loses its advanced status. Cancer treatment depends on antibiotics. Why? Because chemo suppresses immune systems. With antibiotics, doctors can treat infections that appear during immunosuppression. Without antibiotics, many chemo regimens become too dangerous. So oncologists either reduce intensity, delay cycles, or avoid certain treatments entirely. Now, transplants. Transplants require immune suppression. Without antibiotics, infection risk becomes catastrophic. So transplant programs effectively pause. Same with many complex surgeries, heart surgeries, major abdominal procedures, orthopedic implants. The chain reaction is brutal. When you can't prevent or treat bacterial infections reliably, you can't safely do medicine that makes you vulnerable to them. So in a month, medicine regresses, not to the Stone Age, but to a world where advanced procedures are rare and desperate. After the first month, hospitals face a new identity. They become places people fear, because hospital-acquired infections become harder to control. Every catheter is a risk. Every ventilator is a risk. Every surgery is a risk. So hospitals shift strategy. Less time admitted, more treatment outside, stricter isolation rooms, more emphasis on airflow, filtration, surface disinfection. The winners become the institutions with the best: sterile technique, infection control teams, facility design, and rapid diagnostics. Because once antibiotics are gone, the fight moves to prevention and detection, not cure. And that changes medical economics too. It's cheaper to prevent than to treat. But prevention requires discipline, staffing, and systems, and not every hospital can scale that overnight. Here's what people don't think about. Dentistry. Tooth infections can spread fast. Right now, antibiotics buy time. Without them, dentistry becomes urgent medicine. Abscesses become ER problems. Now simple wounds, a kitchen cut, a scraped knee, most heal fine, but when they don't, the escalation becomes scary. So society adapts, more protective behavior, more cleaning, more avoidance of risk. This is where daily life changes. Not because everyone is dying, but because the cost of mistakes rises. And the cost of mistakes shapes culture. So you get a world where prevention becomes social law, hand hygiene becomes extreme, wound care becomes ritual, crowded spaces become riskier, medicine starts spilling into lifestyle. So does modern medicine collapse? It transforms. The new pillars become prevention, rapid diagnostics, physical control of infection, supportive care. Prevention means sterile technique, airflow control, surface disinfection, vaccination where possible, and reduced invasive procedures. Diagnostics becomes king. If you can identify infections early, you can isolate and respond faster. Physical control means drainage, cleaning, removal of infected tissue. Supportive care means fluids, oxygen, blood pressure support, and intensive monitoring. Would this save everyone? No. But it keeps society alive, and it drives innovation. Phage therapy, new antiseptics, immune-based treatments, better hospital design. So the real answer isn't medicine disappears, it's medicine becomes obsessed with avoiding bacteria. Because once your cure is gone, prevention becomes your religion. So how long until modern medicine collapses? In days, elective care stops. In weeks, surgery and childbirth become far riskier. In months, chemo and transplants shrink hard. Within a year, healthcare becomes prevention first, and society rewrites norms. The real collapse isn't a single moment. It's the loss of confidence. Because modern medicine is built on one assumption: we can control bacterial infection. Remove that, and medicine becomes a different game. If you like this expert breakdown, hit like and subscribe for the next scenario. Now your turn. If you could prioritize one thing in an antibiotic-free world, what do you invest in first? Hospital design, diagnostics, prevention protocols, new therapies? Drop your answer in the comments.